supposed to choose one of these scenarios
where the employer won't be the only place.
That should be instant access.
I think instant access, which areas that we just put together. Cough up a little bit more.
My concern is not being able to get insurance. I have Parkinson's and my husband is retiring, and when he retires I lose my insurance and I cannot get insurance at any cost.
Due to a change in employment, I had to go 6 months without health coverage, and when I had to pay for my prescriptions myself, it was $400 and $500 for the same prescriptions that I was paying $10 and $20 for.
I was working on a hazardous waste site run by the government, and 3 of us had heart attacks and 2 of us are dead. And I wouldn't have insurance if I hadn't had to go on Medicare disability.
Me and my family, I have 2 sons, we qualify for a Healthy Start, Healthy Families. And you might say, well, that's good, you have free health care, but what is the cost of free health care? We go to clinics and the walls are falling apart and there's mold and mildew and you're almost afraid to go to the doctor because you might get sick there.
I have no health insurance. I can't get my medicines, my daughter's medicines, and I'm very frustrated.
I just don't understand how in the 21st century we can have people that are uninsured.
My primary concern is the money made by insurance companies and pharmaceutical companies that could be better spent on preventative health care.
If they weren't so freaking greedy, they wouldn't be faced with this much outrage from not just us, but Americans all over this country that are stuck with this bull of the cost that they charge.
I mean, you can't make people buy insurance. I mean, everybody wants to have it. They make people car insurance, sure.
But you have a choice of if you want to own a car.
Well, I think you're saying they're taking it out of private insurance hands and making it state-run.
Our vision is health care for all U.S. citizens with the choice, our personal choice of a provider.
And we're interested in equal treatment and equal quality.
Chronic care would be a part of that, the basic plan. Because if you're going for your chronic care, that'll help, that's the preventive measure from it becoming catastrophic.
And we also like the ideas of the medical homes.
The medical home, the idea, what do you like or not like?
It was very limiting. It didn't allow you to choose at all, and that you had one physician who would be dictating who your specialist would be.
I think it's kind of laughable looking for the government for any kind of help on health insurance. The mess we're in now has been going on forever, and we've had government since 1770-something.
I think the healthcare industry is looking at being profitable. Under the state, it would not be a profitable industry.
It costs more to go to a restaurant and have a baked chicken meal versus a fried steak or a fried hamburger. So, you know, if you can't afford health insurance, then how are you going to be able to afford to keep your family healthy at home?
Now, how do we make people healthier? We figure that we should have patient education, start early, young ages, get it into the kids' minds at an early age, and even get reinforcement classes from the parents, so to speak. Basically teach the parents how to teach their kids.
If you go in and get a checkup and they find something, it's cheaper to deal with it then than it is to put it off. And it's cheaper if everybody would get their you-know-whats into that office at least like once a year.
If one does have good health habits, you know, the notion of like in car insurance, you get some credits for that. Not necessarily that you receive added cost because you're a smoker or a drinker.
So it's a reward in a sense.
Either way, with or without this system, either way we're paying because we're either making up for people that don't have insurance, which we're doing now, or you pay taxes or whatever, which, you know, they said in the end, this ends up being less.
I want to see everybody have insurance. I really do. And I don't, if I have to pay more taxes, I like to see families being able to go. Even if at least they'll be out there for them.
Who pays for the, you know, the smoking reduction programs which are outside of healthcare? Who pays for Weight Watchers?
So how do we pay for this? Personal healthcare income tax, corporate income tax that goes towards healthcare, the current Medicare line item on your taxes, and then providers pay a fee based upon their income. These together add up to basically pay your insurance premium.
What we came up with was everybody pays sales tax no matter where they go. So what we were thinking was you could raise the sales tax a little bit. It's only for healthcare. It can't be used for anything else.
Adding on to the sales tax to help support the health plan, I
think that'd be pretty unpopular. I think the state income tax paid by us, the companies, and so forth would be a much better way.
I would take basic and buy supplemental from my employer.
A sliding scale copay, because not everybody is in the same position. Let's say we're all making a $20 copay. $20 to me is not $20 to Bill Gates.
If everyone is contributing and not just those that have income, I think that would give everybody a sense of, you know, I'm a part of this. Okay. I'm contributing. I'm not just taking from the system.
I don't think we're there yet. I don't think any one of these four is the perfect plan, but I think bits and pieces out of all of them can be put together to come up with something that's fairly substantial.
Everyone should be allowed health care regardless of your sickness or if you're very healthy. Everyone deserves health care.
I guess the thing that I find most surprising is that when I came here, I was very cynical because I didn't think many people believed in the concept of universal health care. I thought that was one of those catchphrases that frightened a lot of people, you know, that's communism and stuff, you know. So I'm just kind of surprised that so many people seem to share the idea that that's a very important concept for our state and our country, basically.
I learned today that the burden that we call a burden of the uninsured is actually a responsibility that we all need to share by government, by individuals, and by the employers.
I came here today very ignorant of this issue, and I'm leaving here very knowledgeable from all your discussions and your personal effects from this. And what I would like to say to the decision makers are, healthcare is not a privilege, it's a right that everybody should deserve to have.
I thought everything was going to be boring today. We were just going to sit back and listen to someone talk.
We surprised
but,
you.
Yeah, you know, it was very interesting. I think we all are here for a reason. And I just say to the decision makers that the decision and what we talked about, that y'all look at that closely.
You can bring a lot of people into a room with a lot of polarized ideas, sit down and work through an issue pretty quickly, and get to some amazing common ground. I would not have come into this room this morning coming up with the kind of ideas we did on my own. But I can very much support and believe in everything we came up with.